Our next guest is a neurosurgeon who is an advocate of minimally invasive approaches to spine surgery. Dr. Hamid Abbasi joins me live now. Doctor, thank you so much for your time. How are you doing?
Thank you very much. I'm doing very well. How are you?
I'm fantastic, thank you. It's great to have you on the program. Can you please, to begin with, tell me a little bit more about the technique that you specialize in?
No, first, before we start that, you need to know that about 1 million spine surgeries are performed annually in the United States. And as a matter of fact, by the time you're 70 years old, if you have never had spine problem, you're among 1 to 2% of the population. So this is a public health issue. The usual way we deal with that, we try to help many patients without the surgery, but a certain number of the people end up needing that surgery. And that surgery is a very invasive, very costly procedure. And because it is invasive, it cannot be offered to many people toward the end of their life, elderlies, that they do need the surgery, but the surgery is just too invasive for them. What we do is practically perform that surgery with much less risk through a tube that is barely thicker than this pen. And so not only we are able to reduce the cost, healthcare costs associated with the surgery and reduce the risk of the surgery, but as well provide it to people who wouldn't be a candidate for this kind of procedure and practically keep them independent toward the last third of their lives.
Okay, and can you go into a bit more detail about how exactly this technique is different from perhaps the current standard of care, other techniques being used?
Absolutely. For lack of other term, the standard of surgery for spine problem is to get to the spine. And either we can literally, not figuratively, literally open your belly, push the organ to the side to get there, or fillet your back. And again, literally, not figuratively, fillet your back to get where the discs, where the problem is. We bypass all of that by using a tube that, again, it's about less than a centimeter. And by using that tube, we don't have to damage lots of tissue on the way of getting there. Not only that reduces the damage to the tissue, but it saves a lot of time. Practically a surgery that would be 7 hours, we do it in 1 hour. A surgery that would have 1,000 to 2,000 cc of blood loss, we perform with a 50 to 100 cc of blood loss. That enables us to expand on the benefit of the surgery without all the collateral damage going with the surgery. And by the way, it is practically hard not to know somebody with a spine problem. So this is not one of those rare conditions. This is practically involved in everybody's life.
Okay, how many of these procedures have you performed?
I have performed 1,450 of these procedures, so we are not novice to this. But in the group, we have performed over 2,000 of this procedure, and we have about a huge body of evidence, lots of data, more than 70,000 data points that shows this surgery is not only safer, it reduces the blood loss to 1/10 of the open surgery. It reduces the hospital stay significantly. And with the COVID, we know how important it is not only keep the elderly out of hospital, but as well keep those resources for COVID patients. But as well, we see that this patient, even farmer, heavy workers, they go back to work within weeks rather than within 3 to 6 months. So we have a huge body of evidence in the last 8 years, and with 8 years of follow-up, we can say statistically, very significantly, this is a game changer in the care of the spine.
Okay, Doctor, before we wrap up, if people want to learn more about this procedure, you've obviously gone into a great amount of detail, but if there is anything else people want to know, if they want to get in touch with you, where can they go?
Well, if you just Google Inspired Spine, that you get to us, and we can set you up with one of our surgeons that in a one-to-one to go over your clinical situation and make recommendation to you. But I think more importantly that people need to know, as a patient in 2021, you have the choice, you have all the opportunity to get the information, and you should be informed more than ever by yourself, by researching your problem to get the information you need for your care. What I noticed that my best patients are those that are best informed, and they have gotten to internet and looked what are the options.
Okay, Doctor, thank you so much for joining us on Ticker News.
Thank you very much for having me.